how to do a routine knee x-ray. We're going to be doing a AP. We're going to do an AP oblique with medial rotation, lateral, and then we need to do a Leclerc method, which is going to look at the intercondylar fossa, and then we need to do a Stuttgart method, which is going to look at the patella floating, also commonly known as the sunrise. The first technique is going to be 70 kV at 3.2 mass, and I'm going to be shooting into a bucking. So now that we got our technique set up, I'm going to go get my patient. I'm Ryan with the radiology department. Can I get your first and last name?
Jules Smith,
And what's your date of birth?
12/17/89.
Is there any chance you're pregnant?
No.
Right this way. So what's going on? Why are we looking at your knee?
I fell down about 2 weeks ago.
Okay, which knee?
My left knee.
Left knee? What were you doing?
I was dancing.
Okay. I'm going to need you to go ahead and get up on the table for me here and lay down on your back. Put some lead on you, protection. So I've got the tube set up right now at a 40-inch height from the table. I'm going to use a CR entrance point of about a ½ inch below the apex of the patella. Collimate in a little bit. Marker on. We're going to go take this shot. X-ray. For the next shot, I'm going to leave the technique the same at 70 at 3.2. And all I'm going to need you to do is to point your toes kind of in a little bit, about 45 degrees. And you can put a little bit of an angle on the tube if you want to open up the intercondylar space, depending on how level the patient's sitting. She seems pretty level, so I'm not going to worry about it right now. So just hold right there. X-ray. For the lateral view, I'm probably going to leave my technique the same as well at 70 at 3.2. I'm going to need you to take this side of your leg and put it flat on the table. You can kind of roll on your side if you need to. And I just need you to bend your knee just a little bit. And if you need to, you can get all the way on your side. So over here. Just like that, just a little bit. So on this one, I will probably put a little bit of an angle on it because your knee's not quite perfectly flat. So I'm only going to do about 5-degree angle. And then bring it down just a little bit to compensate for the distance. I'm going to have a central ray of 1 inch proximal to the femoral condyles. Stay still. X-ray. You can relax. For the next two, I'm going to use a free cassette. You can go ahead and lay flat on your back again, please. And then bend this knee up for me just a little bit. Slide this plate under your ear. This is going to be our Leclerc method to look at the intercondylar fossa. Right there for me. This one I'm going to up the technique, kV just a little bit, probably go up to like 72, 73, just because it's going to have to go through a little bit farther through the knee. So hold on right there. I'm going to keep the mass at 3.2 or 4. X-ray. Last one that we have to do is tangential patella X-ray, where the patient's going to hold the IR for me. Can I get you to bend this knee up just a little bit more? This one we need a little bit of an upward angle on it to try and throw the patella where I need it. It's going to enter about a half inch below the patella apex. Angle that for me. Comb down a little bit. And this one, I'll drop the mass down to 3.2 again. Probably leave it at 65 kV. Hold right there for me. X-ray. And I think we're done. In an AP projection of the knee, you're looking to make sure that the fibular head is superimposed behind the tibia just ever so slightly. You want to make sure that the femoral tibial joint space is open. You want to be able to see the intercondylar eminence, and the patella should be cast above up on the femur so it's out of the field of view. You want to be able to also see the tibial plateaus nice and open. On an AP oblique with medial rotation, which is going to be this one here. This is with lateral rotation, so disregard this image. But with medial rotation, what you're looking for is this space here between the fibular head and the tibia. You want to be able to see that that's unobstructed and make sure that there's no issues there. You'll notice that the patella gets kind of cast off to this side here, and these joint spaces should be open as close as they can, but they might close up a little bit. But your main area of concern is right here at the fibular head where it matches up to the tibia. This is the intercondylar fossa view. What we're looking for on this is we want to be able to see the tibial plateau, we want to be able to see the intercondylar eminence, and we want to see the intercondylar fossa. With this, the common problem is you don't have the knee bent enough, or it's bent too much, and then you end up casting your x-rays through the back of the thigh. So you have to be careful with that. This is the Setagast method. I referred to it improperly in the video. I said the Stuttgart method for some reason, but this is the Setagast method. This is a tangential patella x-ray, and what you want to be able to see is the patella cast above and free of the femur itself. So you want the patellofemoral joint space to be nice and open. And this is a lateral knee. With the lateral knee, what you're going to see is the femoral condyles should be superimposed on one another, and you have to do that by angling the tube or positioning the patient to accommodate for the angle of the medial condyle being larger and sticking down further than the lateral. The fibular head will be superimposed behind the tibia. The knee should be free of both the femur and the tibia space here, so you want to have a little bit of a gap space there, and ideally you would want to have this space opened up a little bit more if you could, but all in all, this isn't a bad x-ray.